The UK's coronavirus hospital death toll has increased by 18 in the last 24 hours, the biggest rise on a Friday since July. England reported 14 new deaths on Friday. Northern Ireland had 2, and Scotland and Wales each recorded 1 amid warnings that fatalities will soar in the coming weeks. It is the largest increase on a Friday since 22 deaths were announced on July the 10th. The UK hospital total is now 34,397. In recent weeks, 9 deaths were announced on September the 11th, 12 on September the 4th, and 10 on August the 28th. The lowest increase on a Friday since the UK went into lockdown was 5 on August the 21st. The highest Friday increase during the outbreak was 953 on April the 10th, when the country was in the deadliest days of the pandemic. The latest figures were revealed after local lockdown restrictions were announced for large parts of England's northwest, West Yorkshire and Midlands regions, and Health Secretary Matt Hancock refused to rule out a second national shutdown to curb the spread of the virus. Have you been affected by coronavirus? Email your story to webnews@mirror.co.uk. The UK's critical heart rate is between 1.1 and 1.4 across the country, meaning the virus is out of control. NHS England reported 14 new deaths, bringing the total number of fatalities in hospitals in England to 29,719. The patients were aged between 41 and 93, and all had no known underlying health conditions. 8 of the victims were in the northwest, 3 were in the southeast, 2 were in the northeast and Yorkshire region, and 1 was in London. 1 more confirmed coronavirus patient has died in Scotland, said First Minister Nicola Sturgeon. Brings the total number of COVID-19 fatalities to 2,502. Speaking at the Scottish Government's daily briefing, Ms Sturgeon said 23,776 people have tested positive for coronavirus in Scotland, up by 203 from 23,573 the day before. This is 4.4% of newly tested individuals. Of the new cases, 69 are in Greater Glasgow and Clyde, 29 in Lanarkshire and 30 in Lothian. There are 61 people in hospital confirmed to have the virus, up by 9 in 24 hours. Of these patients, 5 were in intensive care, no change on yesterday. In Wales, the death toll increased by 1 to 1,601. The number of new cases increased by 185 to 20,233. Northern Ireland's death toll climbed by 2 to 575, while its case total now stands at 8,943 after 163 new infections were detected. National lockdown in October. More than 10 million people across the UK are currently living under local lockdown restrictions. Tough new measures were imposed in the northeast of England on Friday. Ministers announced that large parts of England's northwest, West Yorkshire and Midlands regions will now face similar restrictions from Tuesday in the following areas: Midlands, Wolverhampton and Oadby and Wigston. Northwest, Merseyside, Warrington and Halton in Cheshire, and Lancashire, excluding Blackpool and Greater Manchester. West Yorkshire, Bradford, Kirklees and Calderdale. It appears a national lockdown could be imposed in England in October in a desperate bid to stop coronavirus from spreading and ease pressure on the NHS. Scientists from the government's Scientific Advisory Group for Emergencies, SAGE, have reportedly proposed a 2-week national lockdown in October to tackle the rising number of COVID-19 cases. The Financial Times reported that they had said a lockdown could coincide with the October school half-term. A SAGE scientist told the FT, schools will be closed for 1 week at half-term, adding an extra week to that will have limited impact on education. The scientist said, if the R number continued at the same level it would break the NHS, and the test and trace system was cracking at the seams. A short period of national rules, described as a circuit break, could be announced in the next week, the BBC reported. The report said the government's chief scientific advisor Sir Patrick Lawrence and Professor Chris Whitty told a SAGE meeting on Wednesday night there would be another serious outbreak and a significant number of deaths by the end of October without intervention. Health Secretary Matt Hancock refused to rule out a new national lockdown and admitted hospital admissions are now doubling every 8 days as he made the rounds on TV and radio on Friday morning. He repeatedly said a shutdown was the last line of defense as he responded to reports that ministers are considering further national measures, even for just a 2-week period, such as imposing a curfew on bars and restaurants. He told BBC Breakfast, "We want to avoid a national lockdown, but we're prepared to do it if we need to." Mr. Hancock urged people to follow the rule of having no more than 6 people at a gathering and comply with tougher local restrictions. He said the big hope is that people will come together and get this under control, but it is a very serious situation. On Wednesday, Mr. Johnson said that a new national lockdown would be disastrous, adding, "I don't want a second national lockdown. I think it would be completely wrong for this country and we are going to do everything in our power to prevent it." Mr. Johnson has faced heavy criticism for his initial response to the outbreak, and his government has been slammed as the COVID-19 testing system buckles under pressure, and many Britons struggle to get a coronavirus test. The NHS test and trace system has seen up to 4 times the number of people trying to book a test as the number of tests available. Experts have said that without effective testing and tracing, it will be much harder to control the spread of the virus and pinpoint larger outbreaks.